Insert the scan body and hand tighten it into place. After inserting the scan body, radiographic confirmation can help to ensure it is fully seated. This is an example of how soft tissue can prevent the seating of the scan body. On the left, you can see that the scan body is not completely seated, while on the right, you can see that it is now fully seated, engaging the connection of the Han implant. If the scan body is not properly seated, the final crown will not seat either. If bone is in the way, you can go ahead and recontour the bone using a bone profiler or using any other instrument to help scrape the bone off of the platform. Ensure you are utilizing a cover screw or healing abutment to protect the connection of the implant when doing so. Although highly variable in shape and size, an intraoral scan body generally consists of 3 distinct components: the upper portion, called the scan region, the middle portion, known as the body, and the most apical portion, known as the base. The scan region is the main component used to digitally register the orientation and angulation of the implant. A flat side is usually incorporated into the design, creating an asymmetrical shape. This helps to index the scan body and improve the surface recognition performed by the laboratory software. Evaluate your scan to ensure that the scan region is clearly captured. If you are having trouble capturing this region, you can easily fill the screw channel with some Teflon tape as shown here. Make sure the tape does not interfere with the geometrical pattern of the scan body. Evaluate the adjacent and opposing teeth to see if the contact areas need adjustments. Here, I have decided to do minor enamelplasty to the contact areas to create broad parallel contacts, allowing for better stress distribution. Additionally, it will make the path of insertion easier and limit black triangle formation as well as interproximal food impaction. To help visualize this, I like to evaluate the path of draw by quickly scanning the adjacent teeth. This can be done with or without the scan body in place to fully evaluate. A feature that our scanners have that you should not use when capturing restorative impressions is the autofill feature. There are times when it is challenging to capture a contact with the scanner. Make sure that you have clean and thoroughly dried the contact areas before you scan. Evaluate the scan in both the color and the model or stone mode to ensure the contacts are completely captured and are smooth, free of any data scatter. If you need any extra or missing data, dry the surface and rescan. The autofill feature may fill in the area, however, it will not be an accurate representation of the surface. As shown here, it is evident which area is autofill. Although it may seem minor to you, it will make seating the restoration much more difficult on delivery day. Best case scenario, an adjustment is needed. Worst case scenario, there is an open contact and the restoration will have to be remade. In the digital world, it is easy to accurately capture and communicate the patient's bite to the laboratory. If the scan body rises above the occlusal table as shown here, it can make it challenging to capture the bite if left in place. It is recommended to remove the scan body, replacing either the healing abutment or provisional restoration prior to capturing the bite scan. Always take the time to confirm the digitally acquired bite with the patient still sitting in the chair. If the bite does not match the patient, you can easily retake the bite scan to capture the correct bite, ensuring the occlusion of your restoration will be correct, ensuring delivery day will be much easier for you and the patient.